Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here today with my colleague, Commissioner Ken Lawrence. Today is Wednesday, December the 2nd. We are in week 39 of the coronavirus here in Montgomery County. As we continue to navigate this very challenging situation, I want to remind everyone that we are all in this together. The decisions that each person makes regarding their personal conduct, whether or not they wear a mask, whether or not they attend a private social gathering, whether or not they answer the phone when a contact tracer calls, impact all of us. This is particularly true in two areas, our hospitals and our schools. In order for a patient to occupy a hospital bed, there must be an actual bed, but that's the least of it. There must also be nursing staff, pharmacy staff, environmental services staff, physicians, lab technicians, and so many others available to support that patient's care. Our Montgomery County hospitals are facing critical limits in terms of their staff. They have all been impacted by staff who've been exposed or infected in the community due to the substantial amount of virus circulating right now. Unlike the spring, when many parts of the country were unaffected by COVID-19 and they could send medical personnel to help, there are no spare staff available right now as the entire country is experiencing this surge. I want to emphasize that most hospitals in Montgomery County are at or near capacity. The majority have had to divert patients from their emergency rooms during the last several days for some period of time. And some are beginning to cancel scheduled surgeries in order to create more staffed beds for COVID-19 patients. The majority of our hospitals have had to care for patients in the emergency department for substantial periods of time because there were no other staffed beds available in the hospital. Understand that when a hospital is on divert, that means if you call 911, no matter what your medical emergency, you may not be able to be taken to the closest emergency room. Additionally, hospital capacity is strained in our surrounding counties. So when any of those hospitals go on divert, those patients may be diverted to a Montgomery County hospital. Similarly, for the school door to open each day for students, there must be teachers, support staff, custodians, cafeteria workers, and bus drivers. This graph shows COVID-19 positive cases from students in green and staff in gray from private and public schools in Montgomery County between October 1st through November 30th. Much like the situation with our hospitals, these staff are being exposed or infected primarily in the community due to the substantial amount of virus circulating right now. So it's not just a matter of students getting back into classrooms, it's making sure that there is the staff there to teach them and make sure their school building is safe and secure. The choices that each of us makes over the next several weeks will have direct impacts on our hospitals and our schools. Please keep the following facts in mind. The CDC has determined that over 50% of transmission of the coronavirus is by people with no symptoms. I'm going to say that one more time. Over 50% of transmission of the coronavirus is by people with no symptoms. The virus is transmitted predominantly by respiratory droplets generated when we cough, sneeze, sing, talk, or breathe. And multi-layer cloth masks that do not have a valve can block 50 to 70% of these respiratory droplets. Cloth masks do prevent transmission of the coronavirus and protect both people that are wearing them. Since the December 1st press release, we have 392 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 21,388. These positive cases are a result of a positive test for the virus, not from the antibody test. 11 of these cases are from long-term care facilities. 7 are from the Montgomery County Correctional Facility, but all 7 of these were new commits to the facility. 3 are from Norristown State Hospital, 6 are from other congregate settings, and 365 are from our community. Now, there is one caveat to these numbers. 281 tests are from the last 7 days or less, but 100 of these tests are from 8 to 14 days ago, and 10 of these tests are from more than 14 days ago. So I just want to be clear that a very big jump that we've seen today compared to the prior several days does not entirely represent recent testing. These positive individuals are from 54 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1-year-old to 94 years old. And as always, you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today, we have 211 females and 181 males. I am sorry to confirm that 2 additional Montgomery County residents have lost their life to COVID-19, which brings us to 878 deaths confirmed positive from COVID-19. One of these individuals passed away at a long-term care facility and the other at home. They ranged in age from 89 to 97 years old. Overall, 461 females and 417 males have lost their life to COVID-19. In total, the age range is from 34 years old to 104 years old. Our positivity rate has shown a slight improvement, which is encouraging. Our 14-day average positivity rate is 7.95% as of Friday, November the 27th, compared with 8.17% as of Thursday, November the 19th. And you can see this is our 14-day positivity rate. As a reminder, the orange line, the very jaggedy orange line, is the number of tests that were conducted on a Montgomery County resident on that particular day. And then the blue line is that 14-day running average of positive tests. So you can see we're starting to flatten out. I'm hoping we have plateaued here, but we won't know that for a number of days yet to come. As a reminder, a positivity rate below 5% is considered suppression of the virus. And this next graph shows our daily positivity rates from November the 14th to November the 27th. And you can see there's still quite a bit of variability in these daily rates. We do have a couple of days where we were getting closer to that 5%, but those couple of days correlate with the Thanksgiving holiday when a lot of people weren't getting tested. So we'll just have to keep a close eye on this and see how this goes. But I'm encouraged that there's been some flattening of our positivity rate. As I mentioned earlier, our hospitalizations continue to increase. Today, 362 individuals with COVID-19 are hospitalized in a Montgomery County hospital, an increase of 92 individuals from last Tuesday, and an increase of quite a bit more than that from 2 weeks ago. 12% or 43 of these individuals are requiring a ventilator. And as a reminder, both hospitalizations and deaths do lag behind cases. So we assume that we have not yet seen the peak in hospitalizations or deaths with this surge. We've now added this information on daily hospitalizations and ventilator use to our data hub at montcopa.org/COVID-19. And in fact, the graphic that you see right now is simply a screenshot from that data hub site. A quick school update regarding the school mitigation order. This order will expire on December the 6th, which is Sunday. This allows all Montgomery County schools to offer the educational method or methods they choose beginning on Monday, December the 7th. So just a couple reminders in terms of fighting this virus. If you are able to work from home, please do so. Do not carpool unless you drive with the windows open and every person in the car has a mask on for the entire drive. Please limit your non-essential trips and travel. Don't leave home without a mask, and put it on whenever you are within 6 feet of someone who's not in your household, even if you're outdoors. Do your best to keep that 6 foot of distance. It really does make a difference. Keep your hands clean and away from your face. Please get tested if you need to or want to. And very importantly, cooperate with contact tracing. It's just vital that you help us understand where there might be outbreaks of virus. If you haven't done it already, please download the COVID Alert PA app. This app does not collect any personally identifying information, but using the Bluetooth on your phone can warn you if you or one of your family members has been exposed to COVID-19. The app has now been made available to young adults, I think down to age 13, I believe is where it starts now, or 14, it might be 14. So the parents with younger, or not too young kids, but teenage kids can certainly encourage their kids to download this app as well. It really helps us in this time of substantial numbers of cases to get an automatic notification if you've been exposed. Our contact tracers are busy. We continue to have 65 members on our team. Due to the large volume of cases, they are prioritizing who they reach out to directly. And we're doing this with guidance from the Pennsylvania Department of Health. We're prioritizing people under 18 years of age or younger, persons 65 years of age and older, or anyone who's part of a community or household cluster or an event cluster. Also, if you were exposed at a school, through a sports team, or at your workplace and you need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. So if you believe you've been exposed to one of these locations, please check your email regularly, and that email will contain lots of information about next steps. We continue to have good availability of testing. I want to urge anyone who wants or needs to be tested to get tested. You simply have to live, work, or go to school in Montgomery County, and you are welcomed at any of our testing sites. We've now expanded our testing site hours from 9 a.m. to 5 p.m. Monday through Friday at all 6 testing locations. It should be much, much easier now to get an appointment. Our hospitals continue to ask me to remind the community that hospital emergency rooms are not to be used for COVID testing. Please use a county testing site or one of the many private sites in the county. Of course, if you're feeling sick, you're welcome to go to the hospital emergency room, but please don't go there just to be tested. If you know that you've been exposed to COVID-19, you should self-quarantine. If you would like to be tested, please wait a minimum of 5 days from that exposure before you do get tested. If you get tested more quickly than that, the test may not be reliable. And even if you test negative after 5 to 7 days, you must still complete your quarantine. As a reminder, to make an appointment for a test with the county, all testing appointments happen on the day that you want to be tested. You cannot book ahead. Online registration is available starting at 7 a.m. on the day that you'd like to be tested by going to montcopa.org/COVID-19. Click on the green County Testing Information button, and it'll be obvious what to do next. You can also make an appointment by phone. Phone registration opens up at 8:30 in the morning on the day that you'd like to be tested. That phone number is 610-970-2937. And we do have Spanish-speaking operators as well as language line translators via that phone number. For the 14-day period ending November the 27th, 54,746 Montgomery County residents were tested. This is an increase of 3,610 people tested compared with the 14-day period ending November the 19th. So this is great. I'm so happy to see so many people getting tested. That really helps us manage this surge. So that brings us to our date-tested graph. And as a reminder, the gray bars are the number of positive cases on any given day, the day that they are aligned with. The red line is the total 7-day average. The pink line is the total 14-day average. That's for all cases in our community. The dark blue line is the 7-day average for cases from the community. The light blue is the 14-day average for cases from the community. And then way down at the bottom, you can see the orange and yellow lines. Orange is a long-term care facility 7-day average, and yellow is the 14-day average from our long-term care facilities. So you can see that we are seeing some improvement in both the 7 and the 14-day running average, which is really encouraging news. But both of these continue to exceed our peak in the spring, and we still don't really have the full potential impact from Thanksgiving yet. I think by the end of the week, we'll have a much better sense of whether or not we've seen additional spiking from the Thanksgiving holiday. It is the first of the month, and so it is time to share our age cohort chart. And as a reminder, the left column shows the age cohorts, and then the next column, the percent of our population that particular age cohort represents. The next columns, beginning with April 1st, show the percent of cases within each of these cohorts and whether they have been increasing, which is red, or decreasing, which is green, compared with the prior month. You can see that over time, older individuals continue to be a smaller share of our cases and younger people a higher share. I am pleased to see that for the first time in a long time, we're seeing a decrease in the 15 to 19-year-old and the 20 to 24-year-old cohorts. So just remember, we remain in a serious and rapidly evolving situation. If we work together, I know that we can suppress this virus. We did it in the spring, and we can do it again. Together, we have the power to keep this virus in check while we await the arrival of vaccine in our community. So please choose the path of making safe choices. Know that you are not alone in making personal sacrifices. And please show compassion and kindness to everyone in our community. This is a difficult time for everyone. And it is by staying united in this fight that we will beat this thing. I'll announce that our next virtual briefing will be Wednesday, December the 9th, and I will be happy to take questions.
We will start our questions this afternoon with Jim Melwart from KYW.
Pennsylvania Department of Health said for the week of November 15th to the 21st, the most recent that they have, they were successful in contacting 13% of new cases. The COVID Alert PA app says 644,000 people statewide have downloaded the app. Curious what you think about those numbers, if there's any value at and I don't want to say at all, but is it accomplishing much of anything? And do you know where Montgomery County is comparatively?
Yeah, I don't have the exact, so actually let me take a step back and just explain that here in Montgomery County, because we have a health department, we have our own contact tracing team. That is not the case for the majority of counties in Pennsylvania. The majority of counties do not have their own health department, and as such, they are relying on a statewide team to do their contact tracing. So here in Montgomery County, as I mentioned, we have 65 people on our contact tracing team. And I don't have the exact percentage in front of me, but our percentages are much higher than that in terms of reaching individuals. I do know that the good news is that of the individuals that we do make contact with, virtually 100% of them are very cooperative and are willing to give us the information that we need and also to isolate or quarantine. I know in previous weeks, we had been reaching about 60 to 65% of the people that we attempted to reach. And I am certain that percentage is a little bit lower now because of the very high volume of cases that we're dealing with. And as I mentioned earlier, we're now working to email a number of individuals, but we're definitely considerably higher than the number that the state announced.
I know there was a surge of testing with the travel rules and Thanksgiving, and anecdotal, or I heard from people who were waiting several days uh, for a test result, test taken Monday, results not coming in until Friday, the week of Thanksgiving. Has that was that common, and has that cleared out now that the holiday week is over?
Well, I only have good information on our county-run testing site, and we continue to get the majority of our results back within 36 to 48 hours. Since we have expanded our testing quite a bit, we will be getting some tests back closer to that 48-hour period, but we continue to get those back. We did have a small data interface problem with the lab for a couple of days intermittently over the last about 10 days. We seem to have cleared that up with Mako. The tests had actually been run. They just weren't showing up as having been run on the patient portal. So hopefully we have that cleared up. I cannot speak to what's going on with the private and other testing sites other than to say that I have heard similar things anecdotally from individuals in the community.
And I'll just ask one question and then pass it off. But your thoughts on the CDC's changes to the quarantine guidelines?
So I haven't actually seen what the final language says, so I can't comment fully. I will say that this is a change that's been under consideration for several weeks now. And I know the goal of this change is to use data and science to look at what we know now about when people are infectious and after exposure, by when someone who's been exposed is likely to become positive or not. And they're trying to use that data to guide some changes in quarantine periods for people who've been exposed, with the hope that it will actually improve people's willingness to quarantine. 14 days is a very, very long time. So once I've had a chance to actually read the final guidance, I don't think it's been published yet. I'll be happy to comment further.
It is up on their site just recently. They did. Put
Okay, yeah.
There.
Sorry, I didn't get a chance to read it before the briefing.
I'm good, Todd. You can go on.
Okay, thanks, Jim. Next, we'll go to Samaria Bailey from the Philadelphia Tribune.
Hello, thank you for the meeting. I see that there were some parents who protested the schools being closed. Do you have a response to that? And do you have any data or indication of how Thanksgiving gatherings may have affected the COVID statistics, the current statistics?
So I'll answer the second part of that first. We're just now, coming up to a week tomorrow since Thanksgiving. And so I don't think we can say yet with any degree of certainty what the impact of Thanksgiving will be. It's really going to be more the end of this week and the beginning of next week that we should have enough post-Thanksgiving testing done that people who may have been infected on Thanksgiving, it's going to take probably 5 to 7 days for them to realize that either they've been exposed or start to feel sick and then get tested. So we'll have a much better sense of the answer to that by the beginning of next week. In terms of what went on here in Montgomery County with schools, the Montgomery County Board of Health required all Montgomery County schools to go back to 100% virtual education for Thanksgiving week and then this week that we're in. And then starting Monday, that requirement is lifted. And the move back to virtual education was for a couple of reasons. One, we were seeing greatly increasing positivity in our community, as well as in students and staff in our community, which I showed in that graph earlier. There were concerns about college students returning to our region from all over the country and potential additional virus coming into the community from them. And worries from many of our schools that they were getting very, very tight on staff and that they might have to functionally close because they didn't have enough staff people to properly staff their buildings. So we made a decision, the Board of Health made a decision to go to virtual education for this period. And that period is about to come to an end. I have said and have publicly said a number of times, I agree with the parents that the best place for students is in the classroom with in-person teaching. And the decisions that the Board of Health made were with the goal of making it more possible for as many schools to be open as wanted to be open here in Montgomery County. Thank you.
Next, we'll go to Deanna Durante from NBC 10.
Hello. I just wanted to clarify again on what you said at the top of the briefing here about hospitals. You had said about their capacity, but I just wanted to see if you could reiterate that so that I get the figures right and then kind of ask some follow-up questions. So when you're talking about hospitals at or near capacity, was that correct in what you said?
Yes, so we are back to weekly meetings with our Montgomery County hospitals, and we had one this morning. And almost every hospital is at capacity. There's two that aren't, but the remainder are quite full and have had to, at least for some periods of time, go on divert over the last 4 to 5 day period.
And so when we're saying capacity, that doesn't just mean that their emergency rooms are full, or is that what that means? I mean, for those of us that don't know all of the.
Sure. Yeah.
So I'm
Yeah.
trying to understand, does that mean that the ICUs are full or that the entire hospital is full? Could you explain that a little bit more?
Sure. So it can mean slightly different things, but typically what it means is the emergency room is full because going on divert sends a message to the EMS community to try not to bring anybody to that hospital if at all possible. So that is usually triggered by the emergency room being full. But the reason the emergency rooms are full is because they cannot move patients out of the emergency room to either a regular medical bed or an ICU bed, depending upon what that patient needs, because those beds are full. And so what they conveyed to me this morning was that they are having to care for patients in the emergency room, in a bed in the emergency room, as if it were a regular room, because there's no other room to move that patient to. And then when those emergency room beds fill up, then they do need to go on divert.
So when we saw things like the surge centers and the military staff come in, is that no longer an option if we have to get to that point? Because you had said that there's no medical teams from other parts of the country to come in. Would that count the reservists and that type of group as well?
That's correct. So we've made some preliminary inquiries with the Pennsylvania National Guard. They don't have any medical personnel to spare. As I'm sure you're aware, they are being utilized around the state, including in one place here in Montgomery County to assist in long-term care facilities. So they don't have any medical personnel to spare, and there's nobody else to come. You know, as I'm sure you've seen in the national news, hospitals everywhere are having this problem. So in the spring, there were people that traveled all over the country to the COVID hotspots to assist, but there's no spare hospital personnel to come this time.
And do we have any, I know I've asked this question before, and I think I'm probably going to get the same answer. Any indication on the level of first responders in the region that have been affected by COVID, who have fallen ill, had to be quarantined, if there's been any other mutual aid for different departments, that kind of thing? Is that something that we've seen? And I know you can't talk about anything other than Montgomery County, but have we seen that here in Montgomery County?
We've seen it intermittently. At the moment, I don't believe we have any serious outbreak among any of our first responders, but we've had a handful of incidences since this began. And thankfully, our mutual aid agreements across our 50 police departments and our EMS agencies have functioned exactly as they're designed to function. And so those agencies have not had problems serving our community.
Thank you.
Next, we'll go to Jason Laughlin from the Philadelphia Inquirer.
Yeah, hi, thank you. I'm going to follow up on some of the questions Deanna asked. As of right now, the hospitalizations you're seeing, would you say those represent infections that were likely identified a week or 2 weeks ago? And wherever that is it not inevitable as today's infections, today's surge, inevitably need to be hospitalized a week or 2 weeks from now, that the hospitals will just be overwhelmed?
So I don't have specific data on when the people that are currently hospitalized initially got sick, but given what we have seen throughout this disease, you are correct that someone who would go into the hospital today was probably exposed a week or so ago and became positive, 3, 4, 5 days ago. Somewhere in that range is often the typical course. We are very concerned about what's going to happen in a week, 10 days, 2 weeks from now. Secretary Levine has very consistently shared modeling that has suggested that it is possible that all intensive care unit beds in Pennsylvania could be filled by the middle of December. I am cautiously, very, very cautiously hopeful, given this sort of leveling off of cases that we're starting to see in Montgomery County. I'm hoping that holds and that we will not be over capacity here in the county, but it is something I am deeply concerned about and why we continue to ask the community to take all of the appropriate precautions. People really need to take this seriously.
And a follow-up question, if you don't mind. Is there anything, you mentioned the lack of people to come in and help. Is there any steps being taken to bolster supplies of ventilators or PPE or to create additional bed space in any way?
Here in Montgomery County, and again, as I said, I spoke with them all this morning. They are fine on PPE and they have enough ventilators. Their biggest pressure point right now is staff. There's one hospital that has dozens of people currently in isolation or quarantine because of either COVID positivity or exposure, not from their work at the hospital, but from community exposure. So this is the importance of our whole community understanding that we are in this together, and it's each person's actions that are going to make a difference over these next few weeks. We have to get the community spread down in Montgomery County to help keep everybody safe so that these hospitals can function.
And very quick, you said that modeling from the state was all ICU beds could be filled?
That's correct.
And lastly, would you be able to say what hospital it is that has so many staffers that are in isolation right now?
I'm sorry, but I can't.
All right, thanks very much.
Thanks, Jason. That concludes our first round of questions. I'm going to open it up to any of the reporters we have on the call to please indicate via WebEx a raised hand if you have any follow-up questions for the commissioners. Jim, it looks like you took yourself off mute, so please go ahead if you have any.
Looking for a raised hand. I can't find one. I have a couple kind of not necessarily related to what we're currently talking about, but the one question, or the one thing that I've heard, and I'm curious if this is still a reality, is if vaccines prevent someone from getting sick from the virus rather than preventing them from getting the virus, so they're sick, they're not sick, but they could still spread it. Is that a possibility? And if so, is that a danger, or not? Maybe danger is too harsh of a word, but is that a concern with healthcare workers? If they get the vaccine, then they don't know if they're infected, and then they're working with patients and potentially typhoid Marys.
So I'll share with you what I know, which is largely what's publicly available about the studies that have been done on the vaccines so far. So what these initial studies have looked at is the safety and the efficacy of the vaccine in preventing disease in the person who received the vaccine. And the good news there is that we've got at least 2 vaccines that appear to be greater than 90% effective for the person who received the vaccine. And that is fantastic news. They are 90% or over 90% effective in preventing them from either getting the disease, or if they do get the disease, having a severe case of the disease. So again, great news. What these studies have not looked at, as far as I'm aware of, is whether or not, if you have the vaccine, you can still transmit the virus. So to your point, you don't get sick, but you're carrying the virus and you could potentially be contagious. Those studies still need to be conducted. And I don't know if any of the companies have started to look at that. I believe they all intend to look at that, but we don't have any information on that right now. So again, even once we get vaccines, you're going to hear me say that you need to continue to wear a mask until many people are vaccinated, and we have a better sense on whether or not, even if you've been vaccinated, you could still transmit the virus.
I'm good, thanks.
Are there any further questions from any of our other reporters? Okay, hearing none, that concludes our questions for today.
Thank you.